They were just 100% wrong about it, meaning Pfizer, the FDA, the CDC, and Moderna.
The regulatory authorities around the world.
Yeah.
Britain, New Zealand,
it's just
Australia,
amazing. It's amazing how they all got it wrong in the exact same way.
It's almost like an orchestra that all works together, isn't it? All of the violins are in sync because there's a conductor at the front.
Yes,
and they follow the conductor. And of course, we're not saying there's a conductor in this case.
and if you notice that, they call you a conspiracy theorist. We have a special guest. I want to get right to him. Dr. John Campbell, a retired British nurse educator and YouTuber known for his informative videos on healthcare topics, particularly during the COVID-19 pandemic. He holds a PhD in nursing from the University of Bolton and previously worked as a nursing lecturer at the University of Cumbria. Through his YouTube channel, which has amassed more than 3 million subscribers, he provides evidence-based explanations of complex medical issues, making them accessible to the general public. He's also the author of several nursing textbooks. Please welcome to the show, Dr. John Campbell. Hey, John, how are you?
Hi, Jimmy. We certainly try and do those things, and it's great to meet you at last. Destiny has finally brought us together into this conversation. So no idea what we're going to talk about, but certainly looking forward to it.
I'm very excited. I've been a big fan and follower of your show. Your show has been a real touchstone for a lot of people, me included. And so my audience loves when I share your stuff, and I appreciate that I can share your stuff. So I just want
to... thank you for using it. It's great. You've used it several times, and it's good to see it bounced on, and especially into the States.
Well, it's you seem to be the only one who's doing such great work like this to make it accessible to people like me. And so let me just start off with so I became aware of you because of COVID, although you've been, a teacher and informing people for a lot longer than that. But you were the only place I could go to for actually unbiased truth and objective reporting on what was happening during COVID. When did you, now I know you're vaccinated. I also am vaccinated. I got vaccine injured. I know you had.
I did too. I believe I did as well.
You had a blood pressure issue, right?
Yeah, I believe so.
And you never had blood pressure issue before you took the COVID vaccine?
Never had it before. So I took the third vaccine, and I check my blood pressure regularly anyway. And about a month after the third vaccine, I checked my blood pressure, and it had gone up to about 160 over about 90, 95. Then I went on blood pressure meds, and it came back down again. And I stayed on blood pressure meds probably for about 2 years. And then I started going a bit dizzy, which means my blood pressure was going down. Checked my blood pressure, and it was quite low. So now I'm only on very, very low doses of blood pressure meds now, or sometimes none. So it seemed to last for a couple of years. It was really strange. It went up, managed it fine with meds. It was okay. Then now it seems to be all right again. So, and I've talked to a few people who've had vaccine injuries of different types, and some it seems to last for a long time, and many people are still suffering severely as we speak. But others do seem to recover after a couple of years. I don't think it's any good reflection on the vaccine. It just shows what an amazing human body we've been equipped with, Jimmy, that, it can recover even from the most egregious type of insult over time.
Yeah, my blood pressure also spiked. It was at 180 over 120, which I think was...
it's high, yeah.
That's very high. So, and I was getting bad headaches. But so for me, that's what... I just bought into the propaganda. I told people to wear masks. I told people to get their vaccine. I told people to social distance. I even had a fight with my brother over it, and which kind of, we didn't talk for a long time, which was very unfortunate. But we're back together again, thank God. Yeah. But so when I got my second jab, I never got better. I just felt like I was sick the whole time. I had nerve damage in my neck. I had headaches and body. And so that's what made me, so I tweeted about it. And I said, it's been 5 weeks since my last jab, and I'm still feeling all these symptoms. Boy, did people come at me for that. They're like wanting me to shut up about it. But luckily, a doctor saw the post, and he got me treated. And I found out I was vaccine injured. So that was what made me start to look into it. And I brought on Dr. Robert Malone, who was the inventor of the mRNA vaccine technology. And he explained everything about the vaccine to me, about immune escape and a leaky vaccine. And you can't vaccinate your way out of a pandemic. So that was like such an eye opener for me. And so then I figured out that the vaccine didn't stop transmission or contraction, which I got striked for saying that. It's a fact. And YouTube gave me a penalty for that. Now, so that's what made me suspicious and start looking into it. What was it that made you suspicious that we might be being lied to about COVID?
Yeah, sure. The strike I got was for the interview with, I think it was Pierre Corey, when we were talking about ivermectin, which YouTube doesn't let us talk about now, thankfully. So my story is basically I trained nurses for 28 years, 29 years. And because you're doing like professional education, and we train nurse practitioners and all sorts of people like that, it was vital that we kind of followed the government guidelines. So the government would send new guidelines out on, say, resuscitation. We'd learn those and we'd go and teach them. Or new guidelines on anaphylaxis, we'd learn the guidelines and we'd go and teach what the guidelines said. So we had this lifetime of following guidelines. And I actually knew some of the people that wrote the guidelines, or some of the guidelines, and they were pretty good. You know, they did their best. They did an analysis of the literature. They put that into the guidelines. We have this group called the National Institute for Health and Care Excellence, as it's called now, which of course is a suspicious title. Anything with excellence in the title has got to be a bit suspect. But so it's a bit like whenever you've got democratic in the title of a country, you can be pretty sure it's not very democratic. And anyway, we had these guidelines and they seemed to make sense. And for a long time, I believe they did, expert opinion. So when the pandemic started, I basically followed on from these guidelines. We had the Prime Minister, and it was my assumption that he was well informed by the Chief Scientific Officer and the Chief Medical Officer and other scientists. But then I started noticing things which weren't quite right. And it's one of these things, you know, Jimmy, there's a saying in medicine that the retrospectoscope casts a clear white light. You know, when you're looking back, it all becomes really obvious. But at the time, it wasn't, at least to me. And of course, you know, I kicked myself for taking so long to realize that things weren't what they seemed. The thing that really started me being suspicious in sort of mid-2021, I guess, was starting to talk to people that were vaccine injured. And again, to begin with, this didn't really surprise me because we knew all drugs had adverse events. And I actually got the third one of these wretched things before I realized it was a bit of a racket. It was about a week after I got the third one, I realized that things weren't what they appeared to be. So it was a bit of a shock, really. What? These national guidelines are wrong? Yeah, they're wrong. I believe they're wrong. And then when I got that more realistic mindset, a lot of things started falling into place. And as well, at that time, I started talking to world-leading experts. So, you know, we've talked to like one of the world's leading immunologists, Professor Clancy in Australia. You know, one of the world's leading oncologists, Professor Dalgleish in the United Kingdom. And they were saying things again which were inconsistent. But when they said it, you know, because I've done a science degree years ago, you know, you think, oh, wait a minute, that makes sense now. And at the time, I think my sort of blind obedience to authority overruled my sort of analytical thinking. I was still in a subservient mindset, but that's changed now because a lot of the things that were done were suboptimal, to put it mildly. And some things we did, of course, were blatantly harmful. The risk-benefit analysis from the vaccine was never favorable in my view. You know, Joseph Freeman did a reanalysis of the original trial data, which shouldn't have needed done really, but it was done. He was a doctor in Louisiana at the time. And basically, you know, about 1 in 800 people were getting serious adverse events. This should have been more than enough to have the vaccine withdrawn, more than enough, and yet people persisted with it. You know, the saying, when you're in a hole, stop digging. But they just kept on digging. And although the backpedaling has been there now, it's still there to an extent. And people, of course, don't want to admit that they got things wrong. But really basic things wrong. Things I said at the time, for example, the way the injections were done weren't right. They were sticking the needle in and not aspirating the needle. I mean, I learned to do that. My charge nurse taught me to do that when I was 18 years old. You know, and so, if you didn't do it, you'd probably get sacked. You know, it was but.
So why do you think
that just didn't make sense?
Why do you think that that's such a simple thing to make. So tell people what aspiration of the needle is, and
Sure.
can you tell us why would they be resistant to telling people to aspirate the needle when they're giving you a vaccine?
Yeah. So when you're giving an injection into a muscle, the aim is to put that injection into a muscle, not into a vein. Because some things, if you inject it into a vein, or even worse, into an artery, it can have really bad side effects. So, for example, if you inject something into an artery, it can cause what we call distal necrosis. Things that where that blood goes can actually kill that tissue. Giving an intra-arterial injection is really dangerous. But if you give an intravenous injection, that's going to go into the systemic circulation. It's going to go all around the body. Now, sometimes you want that, of course, but most times you don't, because you want the level of drug to rise slowly in the blood. So when you're giving it intramuscle, you want it to go into the muscle. So you stick your needle in. Now, we haven't got X-ray eyes. We haven't got ultrasound eyes. So how do we know we're in a muscle? How do we know we're not in a vein? Because, of course, the reason muscle is alive is because it's got arteries and veins taking blood to and from it. It's got to have a blood supply. So what we do is we stick the needle in and then we pull back on the plunger. Now, if it's in a vein, the red stuff comes back into the syringe and you can see it. You can see the blood. If it's not, you pull it back. If you don't get any blood going in, then you inject it. Now, the vast majority of times you stick a needle into a muscle, you don't get any blood back. I think I can remember getting it about once. And most nurses you talk to, I'll have seen it once or twice in their career. Probably 1%, 2%, 3% of intramuscular injections, you might get blood back. Depends who you're injecting, of course. If it's someone, young and muscular and athletic with lots of blood supply to the muscles, you could be hitting it much more frequently, in young athletic men, for example, or, bodybuilders down the gym. So you've got to make sure it's in the muscle so it's not absorbed into the body quickly. And yet the Green Book in my country, which is like, it's like the Bible really of how you give injections, it said don't aspirate injections. Now, how that got there is a mystery. I must have talked to a couple hundred people about this, doctors and nurses. And when you explain this, they say, well, why wouldn't you aspirate? Why wouldn't you check you're in a muscle? And it seems, it's hard to put this together, but it seems a while ago, the World Health Organization changed the guidelines for pediatric vaccination because they wanted to be able to inject the kids, do it quickly without hurting. And that's another point. When you see people, I remember Joe Biden getting his injection and the guy goes, and it was like the whole thing was done in about a second, as if he was taking a pride at how quick he was, like gunfight at the OK Corral or something. This is how quickly I can do this. But of course, when you squirt it in quickly, the pressure is going to be much higher. And when you've got high pressure going into a muscle, then you're going to damage the local blood vessels and you're going to get more intravascular absorption as well. So that's another no-no. But it seems the World Health Organization changed the guidelines for pediatric injections so we didn't hurt kids when we were injecting them. And somehow, which I can't trace, somehow that got transposed, conflated with adult vaccinations, and it ended up that you don't need to aspirate, which is just ridiculous. You have to give the right drug via the right dose, the right dose of the right drug via the right route at the right time to the right patient. And if you're not aspirating, you don't know if you're giving it into the right place or not. It just seems very, very hard to explain. But because it's in the guidelines, people follow it. Healthcare these days is very much about following guidelines rather than using your brain. If a new patient comes into hospital, you kind of look up the guidelines rather than thinking, well, let's think about this patient. Let's assess, plan, implement, and evaluate on a personalized basis. Rather than that, I'm afraid people just tend to follow guidelines.
And so that change to stop recommending aspiration of when you vaccinate someone, that came from the WHO. Now we've learned,
as far as I can tell, that's where it came into the British guidelines. Yeah.
Now we've learned that the WHO is at most generous term, it's corrupt. And in the least generous term, it's a criminal organization run by a criminal. I think it is a criminal cartel, but it's corrupt. And
there's certainly scope for improvement. Yes. Yeah.
So people don't realize that the previous director of the WHO admitted, I have the video where she said that we have to go around begging for donations to people around the world, and our biggest donors, we have to do what they want. And so the biggest donor to the WHO is Bill Gates through his Bill and Melinda Gates Foundation and his Gavi Foundation. And they all look like, philanthropical or organizations. But of course, it's more like philanthrocapitalism that Bill Gates he's never really doing anything to help people. He's doing something to where he's going to get a big return on his investment. And he's bragged about how much money he's gotten back on his investments in vaccines. It's a 200-to-1 return or 20-to-1 return, he said. So he's a
very shrewd businessman. Yeah.
Yeah. He put in like 10 million. He got 200 million. Well, for the COVID vaccine, he made $550 million. And so do people, how are people in the medical establishment? Are they aware of the corruption inside the WHO? Because Bill Gates basically is the biggest funder to the WHO, and he basically dictates what they do, and it basically comes down to what's going to pad his bottom line. So go ahead, take it where you want.
Yeah, most practitioners that I know and I have worked with, they follow the guidelines, and they're not really that aware of how things got into the guidelines. So I would think it would be a very, very tiny shrinking minority of individual healthcare providers in the UK who would understand the way things work in the World Health Organization. I don't profess to understand how things work in the World Health Organization. I just know I'm very suspicious of it, and I quite like to get rid of it. And I believe they're trying to get more powers all the time. But most people don't think that far. I think most people are at the kind of stage I was at in 2020. They still kind of trust the guidelines. Because to be fair, most of the guidelines are pretty good. The guidelines have evolved over a period of time, and people follow these guidelines. But it's not only that they're not aware of what you might call political economic influences on determining on what gets into these guidelines. I don't think they're really aware of the research methodology either. So if there's a particular problem, what you'd like to do is go and look at all the literature, do a critique of the literature, work out how accurate the literature is, and then relate that to the care of your patients. But of course, if you're dealing with a dozen different conditions a day, you can't possibly do that for everything as well as a full-time job. So people just tend to take the conclusions of the guidelines, which you would hope are in the national guidelines, and just follow those. But of course, we have so many problems related to finance. For example, research is very expensive to do. It might cost $10-20 million to do a double-blind, randomized controlled trial on a new drug. And that means that very often it's people with the money that decide what trial is done. So, for example, we've been campaigning to try and raise awareness of the importance of vitamin D. What could be more simple? The vitamin you make essentially in the sunshine. And of course, now it's cold and windy outside where I am in the north of England, and will be probably for the next 6 months. We're not going to make any vitamin D. And yet we know that every single white blood cell in the body has got vitamin D receptors in it. Every single white blood cell that defends us against infection needs vitamin D for optimum function. And most of us simply don't have enough of it. But who's going to pay for the clinical trial to do something which is to prove something which is generic that you can't make any money out of? The money goes into trials which are basically new drugs or modified drugs that could be patented for 15 years that you can get some money back from. I can understand this. It's a business. That's what people do. But it means that what gets into the guidelines is what is being paid for, and research that would be really beneficial doesn't get into the guidelines because no one's paid for it. So very often the guidelines are determined by who paid for the research. And of course, the people writing these guidelines will say, well, what's the evidence for this? Where's the double-blind controlled trials? But they don't seem to get the fact that we only get the double-blind controlled trials that vested interest pays for. This is the problem. And the regulators. The last time a study was done on the British regulators, the Medicines and Healthcare Products Regulatory Agency, I'm pretty sure it was that one. I think it was 76% or 86%, I think, funded by industry. And then we've got this old saying in English: "He who pays the fiddler doesn't call the tune." Oh no, that's not right. He who pays the fiddler does call the tune.
That's right.
So,
yeah.
There's a lot of things, but is the average practitioner aware of this? I really don't think they are. That they're trying to do their best, often in a difficult situation. But our health service is really dysfunctional at the moment, Jimmy. It really is. I mean, in fact, our whole country is pretty dysfunctional at the moment. Nothing really works. If you can't afford a private dentist, you can't get an NHS dentist anymore. It's very hard to see a doctor. You tend to do all this online stuff. We're dysfunctional from the millionaire barrister Sir Keir Starmer, who's our prime minister, all the way down. And it's a real pity because most people are just trying to do a good job, but they're working in largely dysfunctional systems. And it's really strange the way this dysfunctionality has affected so many different aspects of national life. But that's unfortunately where we're at the moment.
But it's not so that you elucidate for everybody how money influences what clinical studies get done on drugs and vaccines. It's always, and so it comes from a big pharma. It comes from, so they have the money to do these highly charged studies, and they of course can. I found out through COVID and through watching you that it's very easy to rig a study to have an outcome that you want, or the outcome that the money interest wants to have. So the studies are not only done by the people with the financial interest on how they come out, but they're also kind of rigged in that way. And if they don't show what they want, what the big money interest wants, if the study doesn't turn out their way, they just suppress that study. We've seen that over and over, most recently with the Henry Ford study, which I'm going to get to in a second. But also the medical journals, which was the most surprising thing to me. So everything is corrupted by money. Not only what studies get done, what studies get published, but the medical schools, the research facilities, also the medical journals are completely corrupted. From where I'm sitting, I've seen it happen. Did you ever? How surprised were you of how corrupt the medical industry is, and how has you discovering all this through COVID? How's it changed the way you view the medical system in general?
Of course, rigged is a very big word. It's probably not one I would use, but you can certainly ask the right questions to get the answers you would kind of like, and you know which questions not to ask, and you pay the best writers and you pay the best statisticians, and if something doesn't quite work out in your favor, there might be a delay in publishing that. There's all sorts of nuances go on here. There's a kind of a professionalization of writing medical journals, which is unfortunate. And it's difficult to know what's going on. Basically, we don't know a lot of what's going on, but I do know excellent doctors and scientists around the world who've written papers on particular topics, who find it very difficult or impossible to get them published in very often mainstream medical journals. So, if someone's writing, for example, about repurposed drugs, or that lockdowns didn't work, or that COVID vaccines didn't save millions of lives, or really anything that kind of bucks the narrative, it can be very difficult to get that published. So there's no question in my mind we've got a widespread publication bias, that what we're seeing is not representative of the totality of research. We're missing so much low-hanging fruit in healthcare. Your body wants to be healthy. If you feed it properly, don't poison it, and treat it reasonably well, for most people, it will give you a lifetime of good service. There's low-hanging fruit that's simply not being done. So eating whole foods, avoiding the oils and salts, avoiding the ultra-processed foods, avoiding the sugary, high-carbohydrate foods, eating the right kind of fats, doing the right kind of exercise, getting your vitamin D, getting your vitamin C, getting enough iodine, eating natural products. This is schoolboy stuff. Anyone can understand this. It's not difficult. And yet, what was the latest figure? Was it something like 60% of calories in the United States come from ultra processed food?
Yes.
It's something ridiculous like that. What is wrong with proper food? Eat food, not too much. This is really simple stuff that's simply not done. And we've got big agriculture, we've got big food, we've got, supermarkets, we've got, these huge conglomerates that very often might not have the well-being of the individual highest in their minds. And there's so many obvious things that could be done that simply aren't done. And we go for all these high-tech solutions, which just happen to be really expensive. I mean, two of the professors I mentioned earlier have both made major discoveries and developments. Professor Clancy's got like a pill you can take. It's basically got some dead bacteria in it, and that will greatly increase the immunity in your respiratory tract. It'll upgrade all of the immunity in your respiratory tract, not just against one bug or one virus or bacteria. It will upgrade everything. And yet, why hasn't he got a Nobel Prize for that? And why isn't it available? It's such a simple thing. It's very, very simple. Professor Dalgleish has got a very simple bacterial preparation that he injects that seems to upgrade immunity over the whole body. Probably suppresses a wide range of cancers. These very, very simple things that could be done. But when he went to the regulatory authorities, they told him there wasn't enough evidence. Well, there's never enough evidence unless you've got a $20 million randomized controlled trial.
Right.
In my view, he had more than enough evidence to start using it compassionately. If they'd licensed that, then he could have gone around the country doing talks, and I could have gone with him saying, look, this simple preparation perhaps protects against a wide variety of cancers, may treat a wide variety of cancers. It's dirt cheap, it's incredibly safe, and if it doesn't do any good, it's probably not going to do any harm. Why don't you give it a chance? And doctors could have done that. It's called compassionate prescribing. But they can't do that because the regulators wouldn't authorize it in the first place. So, what is the point of having all these brilliant professors if we just ignore them in favor of guidelines which are written on a highly selective selection of literature, on very dubious grounds by very professional writers who are often working for paid vested interests?
Yes, as we found out with the proximal origin paper that was bribed. All the scientists in Wuhan were saying at first, they're saying, no, it looks like it came from the Wuhan Virology Center and from a lab. And then Dr. Fauci gave them $8 or $9 million in grants, and they completely flipped their story. And this is all, we got it because we had a FOIA request for the email. So we know this happened. And they went from saying, no, this definitely looks like it came from a lab, to, oh, no, it came from a wet market. It came from nature, after they got an $8 or $9 million grant from Dr. Fauci. So I've learned about that, how they can be bribed, and you can't trust that kind of research or the medical journals because they're all bribed. And so, when I looked into COVID, I found out, like, not only were they lying about the vaccine, they were lying about everything. They were lying about where the virus came from. They were lying about who funded the virus research, the gain of function research. They lied that they were even doing gain of function research. They lied about masks. They lied about herd immunity. They lied about natural immunity. They lied about the vaccine stopping transmission and contraction. They lied about lockdowns. 41% of Black-owned businesses are shuttered permanently in the United States, and no one seems to care about this. I even had Cornel West on my show, and he didn't care about it. He's never said anything about it. And it's just, you mentioned this before. We found out early on that 1 in 800 vaccines of the COVID produced an adverse event.
So it's a serious adverse event,
a serious adverse event. If you go back to, like, say, the swine flu, it was 1 in 100,000 produced a serious adverse event, and they pulled that vaccine immediately. Same thing with the other vaccines. And that didn't happen now. So I don't have any trust at all in any government organization, especially the WHO. Now that RFK is there, it's so funny that we finally have a guy who is the big pharma is scared of and allergic to, and that's what the left in America has always been skeptical of big pharma. We know they're criminals. And then something happened where they flipped and they became the defenders of big pharma. And you're not allowed. They turned science into a religion. That's what the whole right. So science is all about questioning. And during COVID, they told you don't do your own research, trust the science, which is not science. And so, I just want to. So I've been totally destroyed in my trust about any kind of authority when it comes. I go to you first. I go to Dr. Pierre Corey after that, and I go to the Midwest Doctors blog. A lot of other people before I'll take. But I just wanted. Can you go through what is exactly the worst part about the COVID-19 vaccine? I know there's lipid nanoparticles. And it doesn't stay in your arm like they said. So just what the effects of all that is, and this, talking about cancer and virility and so could you go ahead and take it where you want?
So many interesting points there. I'll come on to that, Jimmy. But I think Bobby Kennedy said this is the biggest wealth transfer in the 20th century or something in his book. The real Anthony Fauci. There's a huge transfer of wealth from poorer people to richer people. And the origins thing, well, that paper, the last time I checked, hadn't been withdrawn.
No.
It's actually still there.
Yeah.
And I've talked to biochemists and virologists, and they said, that they knew a while back from the biochemistry of the virus and this furin cleavage site thing, the bits of it that just shouldn't be there, that aren't there in other natural human coronaviruses, that they were convinced of that pretty early on. And the idea that, see, if you have a natural pandemic, you have a reservoir of the virus in nature. So suppose it's in, I don't know, whatever it's in, whatever animal it's in, it'll pop up here and it'll pop up there and it'll pop up somewhere else. COVID didn't do that. It just started one place in one time, at most two. And, it's just the evidence for it being a lab-based leak is overwhelming. And I think two of the main intelligence agencies in the States now say that's the probable origin of it. But it's disconcerting that so many papers have been withdrawn on things like ivermectin, hydroxychloroquine, the vaccine not preventing transmission. These papers have been withdrawn, and yet this paper, which is so patently ridiculous, is still there. But anyway, going on to the vaccine. So you inject this vaccine. First of all, as we've said before, some of it's going into a blood vessel. And these lipid nanoparticles, I don't know if can you see me?
Yeah.
But if that's a red blood cell there, which is about 7 microns in diameter, the lipid nanoparticles on the same scale are about that big. They're absolutely minuscule, something like 80 microns in diameter. So some will go directly into vessels if there's an inadvertent intravascular administration. And because it's given quickly at high pressure, there's going to be damage to blood vessels. So some is going to be getting into these damaged blood vessels and go all over the body. So in other words, it doesn't stay local. You get systemic distribution. It goes all over the body. When we say systemic, we mean all of the body system. So the nervous system, the cardiovascular system, the respiratory system, your toes, your fingers, your ears. Once it's in the blood, it goes absolutely everywhere. So it's this systemic distribution, and they're so small they get everywhere anyway, these little things. And actually, when we look back, we did know that for a while before, and it was basically ignored. But the problem is these lipid nanoparticles go everywhere. Now, before you had an injection, your body had never seen a lipid nanoparticle before. The body's not designed to cope with these. These are not a natural product. They're a synthesized product. And they contain, if we take the RNA vaccines, they contain this RNA, this ribonucleic acid, this genetic code to make the spike protein. Now, what's supposed to happen is the lipid nanoparticles are supposed to be taken in by the cells in your deltoid muscle in your arm, and a few will go to the lymph nodes in your armpits. That's what's supposed to happen. And there, the RNA is supposed to take over the protein-making machinery in your own cell, the ribosomes, make a little bit of this spike protein, cause a little bit of an immune response, and then it magically just disappears. So where do you start with that? Well, we know it doesn't magically disappear. We know it can hang around for 700 days in some studies, because what they did was they took one of the bases in the RNA and they put in a false base called pseudouridine. And David Speaker, the famous virologist in Canada who found out about the DNA contamination, He told me it makes it basically rubbery and plasticky, so the body can't get rid of it. It sticks around for ages, and it can go on and on and on, making more and more spike protein. So that means we can't control the dose. So do you remember I said before, you give the right dose of the right drug to the right patient via the right route at the right time? Well, with an RNA preparation, we don't know the dose.
Because because in a normal vaccine, you know what the dose is, but in an mRNA vaccine, your body's going to start making the dose inside of your body, and they don't know how to stop that process, right? So they don't really know how big the dose is going to end up actually being. So your body starts making spike proteins, for instance, and they don't know how many or how long or where it's going to go, right?
It's quite possible that it could vary by hundreds of times. So, you might make 1 unit, I might make 100 units. It's just completely unpredictable. And where it's going to go. So what actually happens is these lipid nanoparticles are taken in by the cell. The cell goes slurps them up. It basically eats them. Process called endocytosis. Then the DNA starts making this spike protein. And the spike protein is recognized by the cell as being a foreign viral protein. Now, this is really clever. Jimmy. What the body does when it has a viral infection, the immune system can't get into the cells. So what happens is, inside the cells, this viral protein is extruded by the cell onto the surface of the cell. Now, if it's on the surface of the cell, it's now exposed to the body humors and the circulatory system and the white cells. So when a cell is infected, basically it sticks a white flag out the window and says, "Oi, I'm infected here. Come and do something about it." And what the immune system does, it says, that cell there is infected with a virus. That means the virus in that cell is proliferating and multiplying. What I will do is I will eradicate that cell. And if you eradicate the cell, you kill the cell. What are you going to do to all the viruses in the cell? You're going to kill all those as well. So that's what the body does naturally. And so when you get a sore throat, you get a viral infection, you think, "Oh, my throat really hurts." The reason your throat is hurting is because you have virally infected cells and your body's own immune system is killing those cells, leaving a wound in your throat. That's why your throat hurts, because your body's own immune system has made a wound in your throat. And that hurts. So you get this spike protein going onto the surface of the cell. And this spike protein is saying to the immune system, there's a virus in this cell. And what does the immune system do when there's a virus in the cell? Chucks in a couple of hand grenades and takes out the cell, which makes perfect sense because you're killing the viruses. Okay, you're killing a few cells as well, but you're killing the viruses, and the cells in your throat, for example, can recover over a few days. Most cells can recover over a period of time. But this lipid nanoparticle is systemically distributed. That means the RNA is systemically distributed, so it goes to all of the organs. For example, it goes to an organ called the heart. Now, suppose this virus is going through the arteries and the vasculature in the heart, in the coronary arteries. What will happen then is that some of these lipid nanoparticles will be taken up by the cells, which are lining the coronary arteries, lining the vessels inside the heart. And when that is taken up by the cell takes the RNA and makes spike protein. And some of that spike protein goes onto the surface of the cell. But remember, this is now a cell in your heart. So what does the immune system do to that cell when it sees the foreign protein?
It attacks.
Kills it.
It attacks your
kills
heart.
It.
Yeah.
Yeah. So now you're killing cells in your heart. Now, would you like me to come along and kill some cells in your heart, Jimmy?
No, I do not. I would not like that.
No. I don't think that's what we want. But that's exactly what your immune system does, because it's conned into thinking that these cells have a viral infection. So it does the right thing. But of course, these respiratory viruses should be in your throat with cells that recover quickly. Now, once you lose a heart muscle cell, it never recovers. That's it. It's gone. It never recovers. Muscle cells don't recover. So most cells in the body, I've made the odd mistake having a few drinks sometimes on a Friday night, and you might give your liver a bit of a hard time. But as long as you stop drinking after that, your liver cells will recover, because the liver has phenomenal powers of mitosis and cellular regeneration, as does your throat, as does your gastrointestinal tract. But there's two tissues that don't in the body, and that is muscles and nerve tissues. They basically don't recover. And of course, if someone's had a spinal cord injury, think of Christopher Reeves, there was no recovery from that. Because the nervous cells don't divide. And it's the same with the heart. So if you lose heart muscle cells, they're not going to recover. But suppose these cells, the lipid nanoparticles get to the brain, suppose they get to the nervous system. If they get to the liver can probably recover, but the kidneys can be, basically they can go anywhere. And what's also quite nice if you're a young adult is to have functional ovaries and testes. At my age, it's somewhat irrelevant, but when you're young, you want your ovaries and testes to work. You don't want cells being destroyed in your ovaries and testes because your immune system is destroying them, thinking they're virally infected, when in actual fact, it's a spike protein that's on the surface of those cells. So that is the problem. It can damage cells anywhere. And as well as that, there's the whole immune dysregulation thing. And, basically, you don't want to be alarmist about this, but, it's a simple fact that most of us probably get cancer a few times a day. But the reason, God willing, we don't get that terrible disease is because our immune system suppresses it. It kills the cancer. It kills the cancer cells. But if you start fiddling around with your immune system too much, who's to say that immunosurveillance isn't adversely affected? And there's sadly some data from Italy and Japan starting to give some quite worrying signs on that. We don't know how that's going to pan out. It might take a bit of time. But that's why this mRNA technology is fundamentally flawed. And it's not just because there's a spike protein. So, for example, now they're working on an influenza, which is going to make an influenza protein. I don't know which one it is. But it's the same principle. Can you see if that goes everywhere, it's going to be expressing a foreign protein, whatever that foreign protein is, whether it's an influenza protein or it's a spike protein, doesn't matter. It's a foreign protein. And because there's a foreign viral protein on the surface of a heart cell, for example, then your immune system is going to destroy it. So this problem of systemic distribution and autoimmunity is going to be true with this RNA technology, lipid nanoparticle RNA technology as it currently stands, regardless of the particular antigen, that is the particular thing the body recognizes as foreign, it's going to be the same for all of them. So there should be a moratorium on this. So until this problem is thoroughly investigated and answered and safety can be guaranteed. And at the moment, in my view, it cannot be. So
what you're basically saying is we were told that when you get an mRNA vaccine, the COVID vaccine, that it would stay in that muscle in your arm and it wouldn't leave anywhere else. Of course, that's what we were told, and that was not true. Now, that's not true. It goes everywhere. Now, I have a hard time believing that they didn't know that, but I'll give them the benefit of the doubt and say they were just 100% wrong about it. Meaning Pfizer, the FDA, the CDC, and Moderna. Well, the regulatory authorities around the world. Yeah. Britain, New Zealand, it's just Australia, amazing. It's Canada. Amazing how they all got it wrong in the exact same way. It's almost like an orchestra that all works together, isn't it? All of the violins are in sync because there's a conductor at the front. Yes, and they follow the conductor. And of course, we're not saying there's a conductor in this case. and if you notice that, they call you a conspiracy theorist. So that's right. That's right. So if you notice things, things working in collusion, as they would say about Trump, they will call you a conspiracy theorist. So yeah. So So it's dangerous because it doesn't stay in your arm. It goes all through your body. It creates an autoimmune response to your organs, like your heart, for instance. Well, right? A potential autoimmune response anywhere the lipid nanoparticles go. And that these things are still on the market, which is just mind-blowing that they're still on the market. It should be a crime because we now know all this stuff. And not only that, but I want to play this for you. This is Bill Gates. So this is Bill Gates at the beginning of the pandemic, of the COVID-19 pandemic. This is in 2020. And he's being asked about all the adverse events that were associated with the vaccine. And let's listen to his answer.
The side effects for the Moderna vaccine sound concerning. We looked. After the second dose, at least 80% of participants experienced a systemic side effect, ranging from severe chills to fevers. So, are these vaccines safe?
Well, the FDA, not being pressured, will look hard at that. The FDA is the gold standard of regulators, and their current guidance on this, if they stick with that, is very, very appropriate. And you know, the side effects were not super severe. That is, it didn't cause permanent health problems for the things there. Moderna did have to go with a fairly high dose, and so to get the antibodies. Some of the other vaccines are able to go with lower doses to get responses that are pretty high, including the J&J and the Pfizer. And so there's a lot of characteristics of these vaccines. It's great that we have multiple of them that are going out there. And yes, I think
you know the data better than I do. But the data showed that everybody with a high dose had a side effect.
Yeah, but some of that is not dramatic, where it's just super painful. But yes, we need to make sure there's not severe side effects. The FDA, I think, will do a good job of that, despite the pressure.
So that's what Bill Gates looks like when he's got a $500 million investment in a product.
That was really clear, wasn't it?
Yeah, I
didn't know what he was talking about half the time.
I didn't know what he was talking about, and but he used a lot of hand gestures, and he had to swallow a lot. So after he cashed in his stock in Pfizer, and he made $550 million, $500 million on one product, he said this. This is what he said after he cashed in his stock.
It wasn't until early February, when I was in a meeting, that experts at the foundation said, there's no way, there's been too much travel without diagnosis for us to contain this. And then,
so what he's blaming the spread of COVID on is not that the vaccine didn't stop transmission. He's trying to blame it on there was too much travel already, and people. So that's what. So that's his first lie. But now watch his admission. Watch this.
At that point, we didn't really understand the fatality rate. We didn't understand that it's a fairly low fatality rate, and that it's a disease mainly of the elderly, kind of like flu is, although a bit different than.
So he just admitted that the COVID-19 virus had a very low fatality rate of an infection. Fatality was very low. It wasn't this crazy thing we should be scared of. It was very low, and it affected mostly the elderly, kind of like the flu. So that was after he cashed in his stock and made $550 million. So people are still taking a vaccine till this day. Boosters, people are still doing it. It's still available for even the guy, Bill Gates, who's a big liar about vaccines, is admitting that, it has a very low fatality rate, and it mostly just affects the elderly like the flu. And so I guess my point is, I don't know what my point is exactly, but does that outrage you to see that?
Totally. I mean, I think it's good to see that Bill Gates' thinking has progressed, hasn't it? And the fact that he sold some stock in between times, of course, is probably a total irrelevance. We can't possibly say there's a causal relationship there. But no, I mean, what he was saying before, I think we already knew, even in 2020, there was a lot of adverse reactions, and the Moderna particularly. I mean, Joe Freeman's reanalysis showed that Moderna had more serious adverse reactions than the Pfizer did, because it was a larger dose. Why they went for such a large dose, I have no idea. But what a shrewd businessman Bill Gates is. He bought at the right time, he sold at the right time.
Yeah.
I mean, our former Prime Minister, Richie Sunak, his trust fund invested in Moderna in 2013, it was. Again, very good anticipation. Must be a really shrewd businessman to anticipate all that time ahead. You got to really admire these guys for their financial acumen and brilliance.
So I just find it shocking. I had on another person on my show yesterday, a radio show host, and he repeats how deadly COVID was. 3,000 people a day were dying, and
you still get this. I mean, I think the average age of death in the UK was 83. But you know what I've done, Jimmy? I've made a point over the past few years of all people I know that work in care homes. And during that time, during the pandemic time, 2020, 2021, what was happening is people in care homes were getting COVID. And they were getting telephone appointments with doctors because the doctors weren't going to see them face to face in case they got this dread lurgy. They were getting telephone appointments with doctors. And very often, when they were diagnosed with COVID, they were put on end-of-life drugs. And at that time, we were giving a combination of midazolam, which is a benzodiazepine, and morphine, which is an opiate. And, you know, my first-year student nurses should know you don't mix those two. And a lot of people were dying.
Why don't you mix those?
Because they potentiate each other. They have potentiation effects. You know, it's like if you take alcohol and barbiturates, you get a double whammy. It's called a potentiation effect. And that potentiation effect particularly causes respiratory depression.
So you're breathing, so it'll stop your breathing.
Yeah.
So most of the, I've talked about this, that, you know, when someone says, well, my grandmother died of COVID, and that's why I'm getting my booster. I'm like, well, how do you know what your mother died of or your grandmother died of? It's probably the treatment they were given. Even Fauci admits that intubation was the wrong call. And then you're talking about how they gave this drug cocktail mix that stopped your breathing. And so that's probably, and then on top of it, they gave people remdesivir, which is extremely toxic. So I always tell people, how do you know it wasn't the treatment that killed your grandmother? Because that's probably what did it, because COVID has a very low fatality rate. So,
not only did they give them those things that were harmful, they didn't give them ivermectin, they didn't give them vitamin D, they didn't give them high doses of vitamin C, you know, all things that potentially could have been massively beneficial. The intubation thing, we genuinely didn't know that at the beginning, but that was learned pretty quickly. But mixing opiates and benzodiazepines, you know, that's kind of pretty basic stuff, really. Why that was done, why that persisted for so long, and what proportion of people died as a result of that would have made a good recovery. I mean, some patients weren't even given oxygen, you know, when they could have recovered with simple oxygen like that. And in our country, I think we keep records for about 7 years. So, you know, pretty soon these records are going to start being destroyed. And we may never know, because there's no official appetite for finding out what proportion of people in care homes died of COVID infection versus the proportion that died of iatrogenesis, you know, that were actually killed as a result of medical treatments, or killed as a result of medical treatments they didn't get. I don't think we're ever going to know that, but, you know, we're free to guess. Is it 50%? Is it more than 50% would have survived? Quite probably. And so we owe this to these. You know, these are people that have died. These are people that have died. You know, the relatives in many cases don't have the proper closure. You know, these people have a right to know this, and it's just the research is simply not being done.
And here's something that is also not ever talked about in mainstream media, or is excess deaths. So people don't understand what that means, and we've been having excess deaths in all over the world after the COVID vaccine rollout. So people are making a correlation and a connection between people dying at higher rates than they normally do before the vaccine that are doing it now. So they say it comes from the. Can you explain to people what excess death actually means, and what are the studies that prove that people are dying at higher rates than they did before the COVID vaccine?
Yeah, well, the data's getting harder and harder to get. In my country, it used to be readily available, but now it's not. They've changed the way the data is collected. We used to have an office called the Office for Healthcare Improvement and Disparities, and they published really good data till about 2023, I think it was, and then they just stopped. You know, they just stopped. I have no idea why. So the data's getting hard to get, but typically, what was done for the early studies and for the data that we used to publish in the United Kingdom is they took the normal amount of deaths. So you'd take it in maybe a 5-year period or a 10-year period before. So if you took the amount of deaths from, say, 2015 to 2019, that would expect so many people per 1,000 to die per year, in that year period. So many people between 60 and 70 would die. So many people between 70 and 80 would die. This is kind of known, and it's generally fairly consistent. Now, there are spikes when there's world wars, or there's spikes when there's major pandemics. If you look at the mortality rates for the bubonic plague episodes in my country, it's going along, and then all of a sudden it goes like that. From the amount of burials and things. So we expect so many deaths. So we take the average of 2015, 2019. That's the baseline we would expect. And then what we did in 2020, 21, 2022, 21 and 2022 especially, we found out that the amount of people that were actually dying was well above that baseline. So basically, you take an average of what you would expect for the population profile, and you found out there was more people dying than that. But after the pandemic, when a lot of the old people had died, the most vulnerable people had already died, you'd expect actually excess mortality to go down because the vulnerable people had already died in, say, 2020. But it actually went up for quite some periods of time. But quite what it is now, it's harder to tell. It's probably down to nearer a baseline now, but it certainly went up in 2021, 2022 in pretty well all countries, including the United Kingdom and the United States. So we had, after a pandemic, when you would expect excess mortality to be lower because vulnerable people had died, we actually found it was higher for a period of time. So what is that temporarily correlated with? Well, we started doing the vaccines in 2021. Excess deaths increased later in 2021, 2022. Does that show that excess deaths are attributable to the vaccines? No, but there are plausible mechanisms where it could be, and there's temporal associations. So, really it would be quite nice if people put all this together and came to some kind of firm conclusion, but who's going to pay for that research?
Right. That's nobody's going to pay for that research. And they don't even, and by the way,
the government's not going to pay, pharmaceutical industry is not going to pay. When you do a research job in a university, it's all about funding. Where is the grant going to come from? How you publish to get money from the research assessment exercise, and if the funding's not there, right, basically the work's not being done. That's not entirely true. I'm in touch with a group of wonderful people around the world. I'm not going to pick on any of individuals, but your listeners all know them, who are working really very, very hard for absolutely nothing. Purely because they believe that there's things that need to be researched. And I won't name him, but one guy I've interviewed, he basically couldn't afford a house for a period of time, because he was spending all his time working on these projects. So people are doing it, but the institutions that can get the research done and get the papers published, the financial motivation, sadly, is not there. So why a lot of these people died during that period of time, it's probably going to be very difficult to be definitive about. But it is surprising that the way that data was collected changed, and the amount of data released was reduced. And it's often difficult to get information even on freedom of information requests. It's almost as if people had something to hide, but of course we couldn't possibly know that, could we? Because we're just the ordinary minions.
Would you refer to what happened during COVID as fascism, which happened in Australia, New Zealand, UK, the United States, and other places? Because I do, because people like to throw that term around today, fascism.
Yeah.
And I have to remind people that, people are like, oh, fascism is going to come to America. I'm like, we already lived through. Is there anything more fascistic or Nazi-like than a government forcing you to take an experimental medical treatment with no long-term studies? I mean, I grew up as a liberal lefty. We always had bodily autonomy and my body, my choice. That went out the window during COVID, and now it's your body and the government's choice. Or you don't get to go to work, or you don't get to travel, or you don't get to go to school or college, or you don't get to go have lunch. So you have to, if you don't do anything. Would you agree that we already have lived through the fascism, and people just brushed it off? They didn't even notice it.
The ironies really are quite delicious, aren't they? The inconsistencies really are quite incredible. The amount of cognitive dissonance that people seem to be capable of living with at the moment is incredible. I suppose a fascist is someone who says, you will think as I think, or I will punish you. So there's many aspects of the British government are like that at the moment. We're very, it's great that some of your senior political leadership have come out in favour of free speech in the United Kingdom, because a lot of people don't have anything like the amount of free speech we would like in the United Kingdom, which we could go on about for hours. But basically, we're living in a pretty uncomfortable environment in this country at the moment. So, was it fascist? Fascist is a pretty strong term. Was it totalitarian, top-down, autocratic, bureaucratic? I would certainly say it was a totalitarian government overreach type of situation. Again, it wasn't that obvious at the time, but looking back, it's patently obvious. And now it's almost as if a precedent has been made now. So, in the United Kingdom, I just checked this the other day, there was 12,183 arrests in 2023 for over 12,000 arrests for social media posts.
Yeah.
I believe that's more than Russia.
Yes,
I believe.
and China.
Probably. 37 police forces made well over 12,000 arrests. How can you possibly have any freedom of debate? I mean, I don't know if I'd use the term fascist, but that's oppressive. It's totalitarian.
It's definitely all those things. I mean,
and it's completely unacceptable. Science and debate. If there's someone that you have a bit of a fallout with, and so we have a saying in England: what happens at lunch stays at lunch. So what you do is you go out at lunchtime and you have a bit of a punch up behind the bike sheds or whatever it is, and then that's it, because you've had a free and frank exchange of views. But when you can't have that, frustration builds up. And frustration builds up into more serious behaviours, because people all over the country are frustrated now because of things they can't say. People are being imprisoned for social media posts, and the police are being used for things that many people think the police shouldn't be used for. Is that fascist? Is it totalitarian? I'd certainly say it's government overreach, and we need a bit of a rethink, because things are quite uncomfortable in many ways at the moment. Government overreach, I'd certainly settle for. Fascist is a strong term, but I certainly see where you're coming from.
I mean, it's gotten so bad in the UK, they're arresting women for silently praying in public, silently.
Yeah. I mean, the Lucy Connolly case, the Graham Linehan case. Did you hear about that?
No, I didn't.
He's an Irish writer. If you've got a comedy there called Father Ted, it's about Irish priests. You probably haven't heard of it. Anyway, it's well known in Ireland, in the UK. He was the writer for that. And he posted something on social media when his plane landed in an airport in England. 5, not 4, 5 officers arrived to arrest him, all armed. What were they expecting? Gunfights at the OK Corral or something? Butch Cassidy and the Sundance Kid. It's just... Okay, there were police officers and they are be armed anyway, but it's not a good look, is it? When you have 5 armed officers arresting one middle-aged man for social media posts. It's and then there was a case of Peter Lynch who was at a demonstration and he died in prison. They said it was suicide. So there's actually been at least one death through that, and yet other offences seem to be given less attention, shall we say. It's an uncomfortable situation. It's drifting towards fascism.
Yes, no, I don't have any problem calling it.
Let's hope we can arrest it before it gets to the stage of...
So can you tell people about cancer and the evidence that it's that the COVID-19 vaccine is causing a spike in cancers?
Yeah. This is one where there's genuinely a lot of unknowns at the moment. What we should do with a medical intervention is wait 5 or 6 years by giving it to a very small amount of people and then seeing what happens. The idea that this was given to, was it several billion people, without long-term studies is still looking back, I still can't work out how people could have done that. How could you launch such a massive scale experiment using an experimental technology on the human race? You know, the arrogance of it when you think back is just completely befuddling that we could do that. But the thing about cancer is there's plausible mechanisms. So just give one example. David Speaker, the Canadian virologist that I've interviewed a few times, he's identified DNA contamination. So there's supposed to be RNA, but there's DNA contamination. And if the DNA gets into the cell, it can go into the nucleus of the cell. And if it changes the DNA in your cell, then that is by definition a mutation. And cancer starts as a mutation, because a mutation is defined as an alteration to the genetic material of a cell. And if that happens, there's mutations and there's potential for cancers there. That is conceivable.
So you're saying you're saying that the mRNA vaccine, the RNA in that vaccine, can get into your cell and mutate your DNA? Is that what you're saying?
No. There's two things. So the RNA vaccines we now know contain DNA contamination. It's not supposed to be there.
Oh, they're actually in the vaccine.
Yep. It's not supposed to be there. So the initial vaccines, I talked to a guy called Josh Getsko about this in Israel, professor in Israel, and he said it's a bait and switch. So during the trials, they used a particular form of, for nearly all the vaccines that were used in the trial, they used a particular form of manufacturing process for the RNA. It was based on a PCR, I'm not a technologist, but it was based on a PCR type thing. So they produced pretty pure RNA. So most of the data in the trials was done by injecting fairly pure RNA for the lipid nanoparticles. But then when they wanted to scale it up, they used bacteria to brew up essentially the viruses in. And the genetic information for the RNA, the genetic information for to produce the spike protein. And some DNA was left in. So the question is whether this DNA contamination that got into our cells is going to affect our own DNA. So we've got the DNA contamination that's in the vaccines that's not supposed to be there, but is there. That David Speaker has showed is there. So there's a DNA contamination, theoretical cancer risk from that. What's the actual risk is harder to tell. But it's kind of a plausible mechanism. So as well as that, there's the RNA. As well as that. So there's RNA in the cell. What's that supposed to happen is the DNA goes from the nucleus of the cell to the RNA in the cytoplasm to make the protein. It's called DNA makes RNA makes protein. But we now know that in some circumstances, RNA can be transferred back into DNA, process called reverse transcription. And the degree to which that's happening, we don't know. It may be happening, it may not. But I've talked to quite a few scientists who consider it to be a very plausible mechanism. So you've got two potential ways there to mess up your own DNA. Potentially from outside DNA as contamination, potentially from RNA via this potential reverse transcriptase mechanism. And again, we need studies into that to find out if that's actually going on. But the main reason I'd be worried about cancer is the immune perturbance. So you're perturbing the immune system. And as we said before, the reason we don't get cancer is because we've got effective immune systems, because we're all getting cancer all of the time. And I talking to some doctors and oncologists, they were seeing in their patients that were vaccinated, whose cancer was in remission, were sometimes getting the cancers reactivated. So Professor Dalgleish warned us about this years ago. Patients he kept stable with melanoma for amazing. He kept patients stable for like 5, 10, 15 years with melanoma. And yet they were getting recurrences after the vaccine. So there's plausible mechanisms. There does seem to be more cancers. There seems to be more cancers in young people. The data's hard to get. Some of the cancers that young people are getting, you wouldn't normally expect young people to get. Some of those cancers seem to develop very, very quickly, so-called turbo cancers. More cancers, especially in young people, are often presenting at a later stage 4, where it's already progressed around the body, to all parts of the body, a process called metastasis. So we're getting this. The data's hard to get, but We've got data from Italy, from one area in Italy where they're able to compare vaccinated with unvaccinated people. And they showed an excess in cancers of some types of cancers in vaccinated people. A bigger study from, I did it just last week. I think it was it Japan?
Yeah, Japan.
Where Japan, yeah, data was released from Japan. And again, it seems to show this for some cancers.
Some cancers, meaning breast cancer, prostate cancer.
Yeah, prostate was probably a big one.
Yeah.
Particularly in older people. Breast, I think colon was one.
Yes.
I think bladder one as well.
Yes.
There was quite a few different cancers that showed an excess. Yeah, there was about half a dozen with an increase. But the problem is, in the UK, even if we get the accurate data on cancers, which isn't readily available but could be got, how do we compare that with the vaccinated versus the unvaccinated? Because that data is not released. So what we need to do is release the data for vaccinated versus unvaccinated, the number of vaccines that people have had. Then that can be compared to the incidence of new cancers. So even if we know the incidence of new cancers, the amount of new cancers, we don't know whether they're occurring more in vaccinated or unvaccinated because we don't have the data released for who's vaccinated and who's not vaccinated. Now, the reason the government and the authorities give for not releasing this is confidentiality, which might sound valid, but of course, confidentiality covers a multitude of sins. Now, I've talked to, there's a British parliamentarian and former science minister called David Davis, who I've interviewed a couple of times. We had a campaign to try and promote vitamin D during the pandemic. And he was science minister in the United Kingdom, and he assures me that there are ways to do this anonymously. So this could be done anonymously, but as far as I know, currently it's not. Therefore, we can't even ask the question. So, because we don't know who was vaccinated and who wasn't on an epidemiological scale.
And that's to me, that's on purpose, that they don't want us to be able to do these studies, and they don't want us to
I know scientists and statisticians who are just waiting for this data to be released, and they'll move. But at the moment, we don't have the data we would like, which it really is a pity. Why aren't scientists chomping at the bit to get this data? It's such an obvious variable that should be considered, and yet we seem to have global curiosity deficit disorder in many of our medical and scientific classes.
Can you?
I've got one question for you, Jimmy.
Sure.
Really, we're both talking about the massive shift that we've both had in our personal thinking.
Yes.
And for me, it changed. My thinking changed in 2021 when I realised a lot of this was just a racket and gobbledygook and unscientific. But looking back, things had been going wrong before that, and I'd been naive for a period of time. But I think 20, 30 years ago, I wasn't. I think things were genuinely okay then. When did that kind of shift occur, do you think? Or has it always been like that and we just haven't realized it?
I think it's always been like that. I've read things about the Rockefeller takeover of modern medicine, right? If you know anything about that, you know that he wanted us to use petroleum-based medicines, and they kind of made every other kind of medical treatment seem like quackery, right? Yeah. And so they were able to get rid of everybody except for the osteopaths, right? So somehow they were able to hang around. And so that I see an osteopath treating me for my COVID injury. And so they're great. And if you go back, it's the fact that if you look into even the smallpox vaccine, right? People talk about it like it's it was the greatest invention in the world. And it turns out people actually revolted against it. And the towns wouldn't allow them to give it to their kids anymore. And lots of the things that are attributed to vaccines, a lot of the health benefits attributed to vaccines were already wiped out because of proper sanitation, less pesticides, things like that. So I think it's been going on. And then, of course, in the 80s in the United States, they got the shield from lawsuits, the big pharma did, to produce vaccines. And so that was the beginning of the end. That was maybe the middle of the end. I don't know, but we've been going through this, I think, for at least since the beginning of the 1900s, and it just got ramped up when they got that immunity shield. It passed through Congress in the 80s, and that's when the vaccine schedule went from like 6 shots to 72 shots in the United States, and nobody even knows about it. I've been at parties in Hollywood talking to doctors, and they're afraid of RFK, and then I tell them about the hepatitis vaccine is the first one they give a baby, and their jaws on the floor, like, why would they do that? And stuff like that. Just so they don't know anything about it either. So I think it's been going on for a lot long. I just think that it got really highlighted, and it became hard to ignore if you're looking during COVID, of all the corruption, all the lies, and how this has all been about. It's all about the reason why we eat processed food in America is because it's makes somebody money. It's all based on, this is like end stage capitalism, where we're poisoning ourselves because it makes someone a little richer. We're spraying all our wheat with glyphosate, which is toxic, right? Which they don't do in other countries. We have all kinds of
bromine, I think.
Yeah, we have all kinds of food additives in our food in the United States that are banned in other countries. And they've gotten people to fear RFK instead of fearing the things he's talking about, which is just so. That's my answer to that. Is I think it's been going on a long time. Can you talk about? Can you quickly talk about like how this has taken an emotional toll on you? Because it's taken an incredible emotional toll on me. I literally have lost lots of my friends, almost all of them in Hollywood. It's because of that groupthink, and they become the enforcers of it and narrative control. And they think that they really are doing a good thing, but they're not. They've turned into, the worst version of themselves. And they've abandoned, the lefties used to be for free speech. They used to be for bodily autonomy, my body, my choice. And they just completely turned all that. And they used to be critical and suspicious of big pharma. And that all went out the window during COVID. So can you talk about how this has affected you emotionally, and if you've been ostracized from certain communities, and how that's affected you?
Yeah, you're right. It's like a complete swap, isn't it? It's just mostly bizarre. Yeah, just mentioning your medicalization point there. I mean, Rockefeller must have been 18 something. So, yeah, I mean, looking back now, I would see that all of my career has been, if you like, over medicalized, an overemphasis on drugs rather than on lifestyle and healthy, healthy lifestyle. I still think things probably got dramatically worse. I don't know. I'm guessing about in the last 10, 15, 20 years, I think things got worse. But, we could argue about that. In terms of me personally, I actually don't work in the health service anymore. I'm not a registered practitioner now, so I don't really have the problem of working with others. If I did, I would have to fall back in and just do what I was told. Which, to be fair, most of the time I will be very happy with, because most of the things that we do are still right. I don't want people to be frightened to go to doctors. Doctors can still save your life. It's, it's still, if you've got an appendicitis, a surgeon will save your life. It's, I'm not gone anti-medical, but we've gone far too far down the medicalization route. And certainly I've focused far too much on that through my entire career, rather than lifestyle factors and general health. And the fact that I never really questioned vaccination before. I mean, I still don't really understand it, but I think things are worse in the States, where you're giving a lot more vaccines than we are to young people, which does make me very, very uncomfortable. I have felt really pretty bad that, I mean, I was always careful never to give medical advice, but when you're teaching things, then people are obviously going to listen to that. And I felt pretty bad that I wasn't sufficiently analytical, certainly during 2020 and 2021. I should have been way more analytical, way more questioning. But that's when the age of deference ended. We talk about the First World War in my country as being the end of the age of deference. Well, for me, it was 2021. I no longer defer to authority. I should have been much more questioning of authority at a much earlier stage, because we know this. Science is not based on authority. Something's not right because Isaac Newton says so. Well, it actually probably is, but in this case. But it's not normally not because someone says so. It's because science is trying to understand the fundamental nature of reality to the benefit of humanity. That's what it should be. So, yeah, I feel bad about a lot of things, very uncomfortable about a lot of things. Yes, there's some people that don't talk to me anymore. Yes, I'm a dangerous conspiracy theorist. There's a few people who don't talk to me anymore. But because most of my closest friends and family I'm able to talk to in a fairly open way, they've understood. I explain things, and they say, "Oh, yeah, I see where you're coming from there, John," and they kind of get it. So most of my close contacts have kind of come along with me, and others just think I'm a on a bit of a hiding to nothing. I'm just humoured, but I haven't upset many of them. But yeah, there's a few people who don't talk to me anymore. But that's kind of okay, because throughout this entire process, I have met some wonderful people around the world. Really class people around the world, both in terms of medical and scientific brilliance. I mean, why some of these people talk to me, I have no idea. I have world-leading professors and researchers coming on the channel talking to me. Beats the heck out of me, but they do. And what I found, Jimmy, as well, is the best people, the world-leading people, are actually really nice as well. They love humanity. They try and help human beings. And any people I've lost, for me personally, has been more than compensated for by this sort of wonderful, I wouldn't even call them a peer group, because most of them are superior to me, but this wonderful group of people that I'm now in contact with around the world, that I've traveled to different countries and met and talked with and done conferences with. And it's been a tremendous compensation. But yeah, it's been difficult knowing that something that you've taught has been wrong. I mean, my entire career we taught sugar is good, fat is bad. Yeah. Because that was the government guidelines at the time. I remember when it came. I remember when the advice for diabetics was high carbohydrate, low fat. We were teaching that, but that's what the official government guidelines said at the time. Looking back, how could it possibly be right giving carbohydrates to a disease where you can't metabolize carbohydrates? But it becomes obvious afterwards. At the time, very often it wasn't. But to many of my new friends around the world, that they were original thinkers, did see these problems at a much earlier stage than I did, but are very modest and very humble about it, and now explain it and try and use their careers, their lifetime of knowledge, to try and help people. Many of them have suffered pretty badly for it, especially the younger ones who are still mid-career, who've lost jobs and lost careers as a result of it. So some even more severe penalties than that. But for me personally, the wonderful people I've met have more than compensated for the distress that has been caused. But yeah, it's been a difficult time.
And I just wanted to, I forgot to ask this when you were talking about how the vaccine doesn't stay in your arm. So you were talking about how the vaccine that they studied in the trials, the COVID-19 vaccine they studied in the trials, was fundamentally different than the one.
It was made via a different manufacturing process, nearly all of it.
So it wasn't the same.
Nearly all of it.
So the vaccine that you and I got in our arm was not
the one that was used for the majority of patients in the trial. Well, they say it was the same vaccine, but it was a different manufacturing process. Yes.
So it was essentially a different formulation because it was made.
It's a bait and switch.
Yeah.
Yeah. Yeah.
Now, how can that? Doesn't that blow you? How can that happen? I just came like, what? They just
how can our regulators allow us to be exposed to this? It just doesn't make any sense. It just boggles the mind. How can the people that are there to protect us fail to protect us to such a dramatic extent as that? And of course, at the time, we didn't know that. I only learned about the different manufacturing processes probably in 2023 when I learned that.
That's that had to outrage you. It certainly outraged me when I found that out.
I was well put out with that one. I was what I said at the time was, this means that I didn't give informed consent.
Yes,
that means that this was given to me via a blag. I was not given had I been given informed consent, had people said, a few of the people in the trial were given the mass production vaccine, but most of them weren't. But the stuff you're getting is just the mass produced stuff, John. No, the goods. We've kept the good stuff for the people in the trials. You can have the mass produced stuff. I would say, get out of here! No way I'm having that. But of course, we didn't know. We were told it was. Oh, what was the words they used? Oh, that's right.
Safe and effective.
Effective. That was it. Yeah, safe and effective. Oh, come on. Yeah. I mean, you've got to make a joke of it, because otherwise I would get. Sometimes I get angry.
Yes.
Sometimes I do get pretty angry, and not so much for myself, but when you meet people like Breanne Dressing, who I've interviewed.
Yes,
for
I've
vaccine
interviewed her.
injury.
Mm-hmm.
It's appalling.
Appalling.
You know, she says she's rolling in cactus all the time.
Yeah.
And if it wasn't for the fact she was a mum, she wouldn't be here. You know, she wouldn't have put up with it. And you know, I met a guy, Alex from Glasgow. He came down to my place, and he's had his leg amputated after the blood clots.
Right.
You know, I'm angry for myself, but I'm absolutely livid for these people that have suffered. And of course, many people, Jimmy, aren't here anymore.
Yes, that's right.
You know, they've paid the ultimate price for other people's lack of diligence, shall we say.
Well, you've been very generous with your time. I really appreciate you. Do you? I just wanted, if you have to go, I understand it's late.
No, I'm okay. Yeah.
So I have one more thing I'd like to go over with
go
you.
for it.
So there's the Henry Ford study. They finally did a study that compared unvaccinated children with vaccinated children, and they did a big study, and it was by doctors and researchers that were pro-vaccine. They wanted to actually do a study that shut up the anti-vax people or the vaccine skeptics, and to show that there was no health detriment to vaccinating children. So they did this study, and well, here's Aaron Siri, who's the biggest lawyer who covers this kind of stuff and sues for vaccine injuries. He just gave testimony to Congress, and I just want to play this for you and get your reaction. Go ahead.
Is this all vaccines or just mRNA vaccines?
No, these are all vaccines.
All vaccines, yeah.
Yeah, so here we go.
The study began by explaining it set out to reduce vaccine hesitancy by assuring parents the CDC vaccine schedule is safe.
So they set out, when they did this study, to reduce vaccine hesitancy, to assure everybody that vaccines are safe. But
which, of course, is the opposite of science.
Yes.
In science, you don't say, you know what, I think I'll go and prove that the Earth is round. No, you go out and see, well, what shape is the Earth?
Yes.
You know, you don't go out and prove something. You go out with an open mind. The answer could be yes, or the answer could be no. You know, the idea that you do a study, you know, why don't I do a study to prove, I don't know, prove that alcohol is good for you? And you probably could, you know.
Yes.
It's just not the way science should work, but we'll accept that that's what they did.
Okay, so here he goes.
Yeah.
Instead, what these researchers found was that vaccinated children had 4.29 times the rate of asthma, 3.03 times the rate of atopic disease, 5.96 times the rate of autoimmune disease, and 5.53 times the rate of neurodevelopmental disorders, which included 3.28 times the rate of developmental delay and 4.47 times the rate of speech disorder. All of these findings were statistically significant. There was also other conditions for which there were numerous cases in the vaccinated group, but zero in the unvaccinated group. Hence, a rate cannot be calculated, including brain dysfunction, ADHD, learning disabilities, intellectual disabilities, and tics. For example, there were 262 cases of ADHD in the vaccinated group, and there were none in the unvaccinated group.
So he's saying that there were no brain disorders in the unvaccinated group, but there were lots of, over 200 in the vaccinated group, like with ADHD, things like that.
Wow.
Studied
Yeah.
around 16,000 kids in the vaccinated group, by the way, and around 2,000 in the unvaccinated group. So the rate, of course, between those is important, and that's what the study compared. These findings were troubling, including because these chronic health issues can be caused by immune system dysregulation, and vaccines can cause immune system dysregulation. Citations for this are in my written submission. Overall, the study found that after 10 years, 17% of the unvaccinated children had a chronic health issue, while 57% of the vaccinated children had at least one chronic health issue, often multiple.
So unvaccinated kids had 17% of them had a chronic health issue. The vaccinated group, 57% had a chronic health issue. Okay.
17 versus 57%. The only real problem with this study and why it didn't get submitted for publication is that its findings did not fit the belief and the policy that vaccines are safe. Had it found vaccinated children were healthier, it no doubt would have been published immediately. But because it found the opposite, it was shoved in a drawer. We have repeatedly urged Dr. Zervos and Lamoretta to submit the study for publication. They have affirmed the study was well designed and conducted. But Dr. Zervos has said he doesn't want to lose his job. And Dr. Lamoretta has said she does not want to make doctors uncomfortable. This is a real-world example of how the science around vaccines gets corrupted, how only studies that confirm the beliefs and policies that vaccines are safe get published. Everything else gets shoved in a drawer. This selection bias is dangerous and results in corrupting all the science concerning vaccine safety. We can protect children from infectious disease, and we can protect children from vaccine harms. We should and we must do both.
So I'd like to get your response to that they actually did do a study. It was done by a pro-vaccine institution with pro-vaccine doctors trying to prove that vaccines were good for you. And the conclusions were the opposite. They were obvious. There was broad and stark differences. And then they never published that paper because it didn't fit the narrative, because they were afraid they would lose their job because of the financial corruption involved in the medical system. Go ahead. You take it wherever you'd like.
Yeah, I mean, it doesn't surprise me at all, but completely appalling. When was this study done, Jimmy? I haven't heard of it.
Oh, really? I thought, okay. I thought you'd be the guy. I went to your channel. I didn't see you had talked about it, but I thought you.
Well, when did it come out?
It didn't come out.
That's probably why.
Yeah.
Yeah.
It got suppressed.
It's probably been hushed up.
It got suppressed, and I guess he found it somehow. And
I wonder when the actual research was carried out.
I think it was not that long ago, because I know Del Bigtree had talked to the guy who talked the guy into doing the study, and he had the doctor who did the study promise that no matter what the results, they would publish. And he said, yes, of course. And of course, they didn't publish. So that's got to be recent. I don't know. I'm going to guess in the last 5 years or so.
I'll certainly look into that and try and find out. I've got people that I'll probably know about that. I mean, the fact that adverse
20. Oh, it's 20. I'm sorry.
published-
My producer just told me that study came out in 2020.
Oh, right. Okay. 2020. Interesting. So, just a few years ago. Interesting, right? The fact that adverse results aren't published is absolutely appalling, isn't it? And the antithesis of science. It's exactly what we shouldn't be doing. And yet it doesn't surprise me at all because of the vested interests that are involved. I've actually been an advocate for general vaccination all my life. And I still think that it's very likely that quite a few vaccines are going to be useful. I mean, tetanus, for example, I've seen people with tetanus. I've seen a baby with tetanus. It's pretty horrible. So there's no question in my mind that some vaccines are beneficial. But we've always just accepted that they're beneficial without really doing any trial data. So it's not really evidence-based. And when the question marks with the COVID vaccines came along, we started questioning other vaccines. And I've talked to people that, again, have been vaccine advocates all their life, and they say, you know what, now I really don't know whether all these vaccines are good or not, because it's actually very complicated. So suppose you take measles. There's been a lot of fuss about measles lately, that anti-vaxxers are stopping people getting measles. Well, if you give measles vaccine, then children after that will get less measles. That is true. But that's not telling you about overall outcomes, though the fact that you get less of one disease doesn't tell you anything about overall health. So if, and I don't know, but if measles vaccine, for example, it's probably a bad example because I think measles vaccine is probably a good idea. But if a particular vaccine prevents a particular disease, then the outcome that we're looking for really should not be that particular disease. It's the entire health of the individual. And we're talking about there from that 57%, they said, with children with a chronic disease condition. So which would you prefer, to take the risk of getting one particular disease and get one particular illness and get natural immunity that might have, I don't know, say a 0.5% of having some nasty outcome, or 50% chance of having a chronic disease forever? So we're looking at the wrong outcomes. We're looking at far too specific an outcome. So a particular vaccine is going to reduce a particular disease. Yeah, for sure. I don't see any problem with that. But what about overall health outcomes is the thing we have to be looking at. And particularly in the States, when so many vaccines are given, giving lots of vaccines all at the same time.
Yes.
That's got to have interactive effects.
Yes.
You know, whenever possible in healthcare, you want one variable at a time. So you know, people will start taking a particular drug for a particular condition. And then if that has an effect, you know that it's the drug that was beneficial because you're dealing with one variable. But if you give 6 drugs at the same time, then which drug was it that's improved the condition? Well, you don't know because you've got too many variables. So we really need to kind of cut that down, looking at, you know, just what's happening here. What are the outcomes? And that's such an obvious one. Protecting against one disease. What about all the other ones? What about the overall effect on health? What about the interactions? But the immune dysregulation, if you're clobbering the immune system over and over again, let me give just one simple example. Whenever you have an infection or whenever you have a vaccine, that's going to stimulate an immune response. That's going to have, vaccine is going to stimulate an immune response. Now, that immune response can be beneficial or it can be harmful, but it's always going to be immune response, and that's always going to use up vitamin D. So when you have a vaccine, it's going to use up some vitamin D. Another vaccine is going to use up some more vitamin D. But because we don't supplement vitamin D and we don't really think it's important, that means if people are given multiple vaccines, they're going to become deficient in vitamin D, which is going to affect their immune system. And we've already said that the immune system is essential for protecting us against cancer, which is another disease outcome. And that's just one example. So given multiple foreign antigens, especially all at the same time, like you do in vaccines, what are the interactive effects of that? If you give one and you have one adverse effect, you've got one variable, but we're giving a dozen of them. You know, how can we possibly say which one is giving rise to which variable? Of course, that's what our clinical trial does. It has one variable at a time, you know, a specific intervention for a specific outcome, but you're giving so many. We don't know. I mean, it seems to me what's happened with the vaccination program in the States is a topsy curve. We call it a topsy curve. So you have one brick and another one on top, and that's fine. That sits on top of it. But then when you put on another one and another one and another one, it starts veering away from what you originally thought. You might end up half a mile away from where you originally thought you were. You know, what we need to do is go back and compare with a placebo, with something we know to be inert. So, you know, it's like saying, is alcohol bad for you? Well, let's give someone half a pint of whiskey a day, and the other group, let's give them half a pint of water a day. And then you find out that the half a pint of whiskey a day is probably not good for you. But we're often not doing that. We're saying, you know, I want to know, is alcohol bad for you? Let me think of a study. Oh, I know. Why don't we give someone half a pint of bourbon and the other half, the control group, half a pint of Scotch whiskey and see what the difference is? You know, it's ridiculous. And that's what we're doing. We're comparing a treatment with a medical treatment or a vaccine with another vaccine rather than nothing, something that's inert. So we need to go back to these fundamental principles. So, you know, you're asking me about childhood vaccines. Basically, the evidence you've got there is pretty convincing. I suspect that they are protected from the particular disease, but what is the overall outcome? How should we be going forward with this? Well, we should be striving for evidence-based medicine. That's how we should be going forward. We should be striving for medicine. I'm certainly going to look that up if we can find that data. That's pretty devastating. We'll splash that around everywhere. But the conditions that you mentioned there, the asthma, that's very often allergic-based, you know, immune-based disease. It's inflammation of the airways, very often immune-based. Atopic conditions, atypy means a predisposition to produce immunoglobulin type E's, I think it is, when you're not supposed to produce them. But atypy means you can just be develop immunity to different things in terms of allergy rather than immunity. All the neurodevelopmental conditions, I mean, these are pretty frightening because a lot of those perhaps won't get better because, as we've said, nerve cells can't reproduce themselves in the adult state. So there's things there that are really quite concerning. Quite a few of them have immune dysregulation, possible causes, possible etiologies. And if you're giving lots of things at the same time, that's just not what the immune system's designed to do. You know, we're good at fighting one thing at a time, occasionally two. You know, I mean, in a natural situation, you might get one disease and another one superimposed. But, you know, the idea that you get a dozen at the same time, like kids get exposed to all these different vaccines, the interactive effects I would say, are impossible to predict because it becomes a chaotic system. It's like the weather. The butterfly flaps its wings and, you get a thunderstorm in Texas or something, because you're giving so many variables all at the same time. I think it's impossible to predict the outcomes. I don't think you can do a study on a dozen variables at the same time. Therefore, if you don't know, you should always err on the side of caution in medicine. First, do no harm. Don't fiddle with things you don't understand, doctors. And fiddle with things you do understand.
And so they try to pretend that they have tested these vaccines against a placebo, but they haven't been. In fact, when they test these vaccines, these childhood vaccines, they, like you say, they test them not one at a time. I mean, they test them one at a time, not as they actually give them. They'll give them in like groups of 3 or groups of 4. Or, within a couple months, they'll give you 6, 7 vaccines, and they've never tested, they've never done a test for that. And that's what RFK wants to do. And of course, they have to paint him as the devil so they could stop that. And people, again, just go along with it. People who call themselves liberals go right along with it without questioning the science because they've turned science into religion.
Yeah, and there are other ways it could be done short of randomized double-blind controlled trials. You can do epidemiological studies. So the Amish, for example.
Yeah.
I'm pretty sure I'm thinking they don't have any vaccines at all.
Right.
And they seem to do fine. What you could do is, you could have groups of people around the country where you give them less vaccines or, different combinations or, you don't need to compare it with nothing. There's many ways this could be done. We've got lots of brilliant epidemiologists and statisticians, and they can dream up ways to do this and analyze this data in ways we couldn't possibly imagine as non-specialists. This could be done. In my view, it should be done, but mostly it's not being done. And there's so many ways we can research these topics, but the will has got to be there to do it.
So they did do a study of Bill Gates's vaccination program in Africa. And they found out that the things that they would be vaccinated for, they didn't get the disease. But those people who were vaccinated went on to die sooner. They had overall a higher morbidity than the people who didn't receive those vaccines. So yes, what you were saying earlier, that if you get a vaccine, it can give you immunity to a certain disease, but does it make you have other diseases? Does it screw up your immune system to you now develop other diseases? And it seems like there's a correlation between that, because the studies seem to show that the unvaccinated people had a greater longevity, and the people who were vaccinated, while they didn't get the disease they were vaccinated for, they died earlier and had higher morbidity overall. And so that they don't ever want to talk to you about that. That's what you were talking about, right?
Yeah, I don't mind too much getting a particular disease. What I want is a healthy life, right? And for our kids and grandkids. If they get kids always get infections. That's kind of okay. I mean, some infections are dangerous. I'm not belittling that, but what we want for our kids is to be healthy overall, and multiple variables, looking at just one simple variable, saying they didn't get that particular infection for that particular period of time, is simplistic. We need research that's a bit more sophisticated than that. And at the moment, I don't think we're getting it. And it's reassuring that study's come out, and it's reassuring that RFK is asking fundamental questions. Very often we don't ask questions that are fundamental enough. We try and be clever. We say, well, what about if you tweak that little bit or that little bit there? Whereas I say, well, why don't you get rid of the whole lot and see what you like? Being absolutely fine. Why don't you stop eating for a few days and see what happens? Why don't you try something that's completely a bit more fundamental? We tend to ask clever clogs questions rather than fundamental questions, and these simple, almost childlike questions are very often the ones that give us the most profound answers.
So let me just wrap up by asking you, how do we stop this from happening again? What happened during COVID, where people lost their jobs, people got locked down, people were forced to take experimental medical treatment, people were censored for telling the truth about COVID. I mean, just a myriad of horrible things happening because of a COVID, which Bill Gates and others now admit was not a dangerous virus. It had a very low infection fatality rate, and it was more like a flu. Yet they did this to us. What do we need to see happen so this doesn't happen again?
Yeah, I mean, we know a lot of people are interested in the control agenda, in the financial readjustment agenda, enriching particular individuals. And I think the particular pandemic scenario that we've seen, they're not going to go for the same playbook again. They're probably going to go for a different one. And we've got to be on our toes to look out for the way that these people are going to seek to control us and control global finances. But they'll probably be trying something different. So they'll probably aim for something that gives the same end, but they'll use a different methodology to do it, because they've kind of played the pandemic card. So what are they going to play next? I don't know. They're going to play the threat of war pandemic, or the threat of civil war pandemic, or the terrorism thing, or are they going to do that? But at the moment, they're still fiddling around with gain-of-function research in laboratories around the world.
Yes,
this is still happening. Now, the gain-of-function research that produced the SARS coronavirus 2 was probably not overt genetic engineering viral research. It was probably multiple generations of viruses and kind of a guided evolution. So they'd find out a virus that infected human cells a little bit more effectively. So they'd like breed that virus up, if you like. It's a bit like breeding dogs. If you want a dog to run fast, then you over 100 generations, you select dogs with longer legs. Or, if you want a dog to smell, to fish out rats or something, you breed up terriers. We can breed up all these different sorts of dogs. You can do much the same with viruses. I suspect that's the way that happened with the SARS coronavirus 2. And that's still happening. But there's also overt genetic manipulation of essentially synthetic viruses, a virus that never occurred in nature. Now, it is quite possible that there could be a virus escapes from a lab that kills, make up a number, 70, 80, 90% of people that infects. That is possible. And it's also possible that virus could spread really, really quickly. And what I've thought is, we have this saying, cry wolf, don't we? What I've thought is, if such a virus came out, would people believe it? I think a lot of people wouldn't. So, if such a virus comes out, it could be possible that you and I'd have to make videos saying, look, I've talked to some of the world's leading experts about this, which I would do straight away. I'd be on the phone straight away. And to tell you the truth, there is a virus spreading from country X that does kill 50% of people that it infects, that does spread as quick as the SARS coronavirus 2 did. Therefore, there's a real threat that this is going to kill half of the population of our countries. That is not inconceivable, given that viruses are weaponized for essentially military purposes. That existential threat remains. So, I'm hoping that's a video I never have to make. I really hope it isn't. But it is possible.
Well, they're bringing digital IDs to the UK now.
Don't start me. Don't start me on digital ID. Everyone in the UK is going to get a digital ID card, as far as we know. It's going to be linked to probably everything. The petition against it is on, I think it's getting on for 3 million signatures of people that have, voted against it now. But all that does is get you a parliamentary debate. But the current government has got such a large majority that basically they can pass whatever they want. They're weaponizing aspects of the power of the state against the individual. And when the power of the state is arrayed against the individual, there's very little you can do about it. I actually went down to this march. I was in London I meant to tell you this at the start, actually. I went down to the march in London on the 13th of September, the Freedom of Speech March. But the night before, I went to the Charlie Kirk vigil in London. It started in Whitehall outside the Montgomery, General Montgomery statue, and went down to Parliament Square. Very moving. Star Spangled Banner was sung in Parliament Square in my country. It was really quite I could feel the tears. It was a touching moment, so much genuine grief. And then the Freedom of Speech March on the 13th, which is also a bit of an anti-government march, to be fair, so many of the policies of the current government are so appalling. And mainstream media, I think, said there's 130,000 people there. Believe that if you want to. My estimate was at least 1.5 million.
Wow.
Probably 2. It could have been 3. A friend of mine looked at some of the footage that was available and calculated the crowd was 800,000. And that was without all the footage being released. The 130,000 figure to me is just a complete laughable joke. But it shows the way that the narrative is being controlled. So people will perhaps not go for the other pandemic aspect, but they'll aim for other ways to control the narrative. They aim for ways to control the individual through artificial intelligence powered. The combination of artificial intelligence, Jimmy, with digital ID cards, that is a pretty frightening combination. That's a bit of a morphine and midazolam combination. That it's the AI could empower the digital identity cards to intrude and control pretty well every aspect of life potentially. Well, every website you would be visited could be analyzed by AI, and you could flag up on someone's computer. It's pretty frightening.
I mean, they can turn off your power to purchase, to buy gas, to pay bills. They can turn off your car now, right?
Turn off your credit. You turn off your credit card. Already people have been denied bank accounts in my country, but they can turn off your credit. Your bank card. They can freeze your bank card. I did a talk on this just a few days ago, and there's that verse in Revelation: "No man may buy or sell, save he have the number of the beast in his forehead or on his right hand." And when I was a kid, that was impossible.
Right.
You would just get a $5 out your wallet if you had it. You spend some money, But now it's quite possible that cash could be discontinued, and you would need a card, and for your card to work, you would need a digital identity, and then it's just a matter of time. Stupid people like me, Jimmy. The ordinary plebs of the country. I'd probably lose my card somewhere.
Yeah.
Who knows? Deliberately on purpose, I might lose it. So wouldn't it be just easier? Instead of having to get your wallet out and get your card out and swipe your digital identity card every time you went shopping, wouldn't it be easier just to put a little chip under there, like we do with dogs? Wouldn't that be? And just scan it. And that would combine your digital identity with your purchasing history.
Yeah.
Just so stupid people like me wouldn't get it wrong. There we are. That's scanned. Whether it's in your right hand or your forehead, well, what difference does it make? It could be a facial recognition software. It's actually quite frightening, because what that means is someone could switch it off. I could go to the shop. Go to the shop, scan my right hand or whatever it was, or if it was in my case, I refused to have it. And they'd say, well, sorry, mate, you can't buy anything here because you haven't got a mark in your right hand. You can see this terrifying prophecy coming true because the technology is there to facilitate that. And if that prophecy is not there as a warning, what the heck is it there for?
Right.
Let's learn from that warning.
They say they chip you for your convenience. Everything's going to be more convenient, but what they're really doing is they're chipping you for obedience.
My dog's got a chip.
Mm-hmm.
All dogs have a chip in the United Kingdom, because if they run away, you scan it and say, "Oh, that's
right.
John's dog."
Right.
Poor thing. Let's take it back to John's house.
Right.
Which is great. But I don't want a chip that's scanned to put every. And then when you can combine that with artificial intelligence, a corrupt government has got complete knowledge of everything. What was that author called? George someone, who wrote 1984. I've got a picture of him in the background all the time, the late great liar, Eric Blair, who's better known as George Orwell. He predicted this. And 1984, of course, was published in 1948. But, 1948, 2048 is coming around pretty quick. The technology is now there, and digital ID is just another thing that makes that possible. And our current government, I trust them as far as I can kick them, to be quite honest. I don't trust them with this technology. Yeah. It's as simple as that. I don't trust them. And I think the capacity for abuse and control is immense. So the control agenda, the financial control agenda is there. I don't think they're going to need another pandemic, Why bother with the inconvenience of a pandemic when you can have cards sticking in someone's hand,
Mm-hmm. And the sad thing is, there's going to be a lot of people who are eager to get that done to them. That's
Yep.
Yeah.
And the digital ID cards are the first step towards that. But to say you can't go shopping with a digital ID without a digital ID, that's a pretty small step.
Yeah.
We don't want you. To be fair, Jimmy, we don't want useless eaters on the planet, do we?
Useless eaters.
We don't want useless eaters. People like me that just consume food and don't do anything useful. I can be safely eliminated. What's the problem?
That's right.
This is, there's people in the world, it's a joke, but there's people in the world think like this, and it's terrifying.
I know.
And we don't want to give these people control.
They've got it, and it's up to us to fight back against it. So. It
certainly is. Yeah, we don't want digital ID cards. Thank you very much. So especially combined with artificial intelligence. But we're going to get them because this government's going to enforce them on us.
Yeah, well, good luck.
Yeah.
Dr. John Campbell.
We're going to need it. We're going to need it.
Dr. John Campbell, it's been a real treat to have you on. I really appreciate you being generous.
It's been a pleasure, Jimmy. Thank you for all you've done.
And thank you for all your guidance and for your courage to speak out and tell the truth during these really dark times. I really appreciate it. You're a real hero for everybody here at the show.
Try and follow the evidence wherever it leads. Even if we don't like where it leads, we'll still try and follow it.
Everybody should check out Dr. John Campbell's YouTube show. I do all the time. It's fantastic. Thank you so much again. I hope we can talk again soon.
I hope so, Jimmy. That was great. Yeah. Some important topics, though. Let's hope people are listening.
Yes. Come see me on tour. I'll be in Sacramento, San Francisco, Irvine, California, Sydney, Melbourne, and Brisbane, Australia, and then Burbank, California, the day after Thanksgiving. Go to jimmydore.com for a link for tickets.